everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Bisoprolol. Its brand name is Zebeta. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So bisoprolol is a cardioselective beta blocker. It blocks beta-1 adrenoreceptors. In terms of indications for use, or reasons we would prescribe this medication to a patient, we often see it used in the treatment of hypertension or high blood pressure. This medication can be used to treat chronic angina pectoris or chest pain. We also see it used in congestive heart failure, as well as prophylactically to treat migraines. Now before somebody was to use bisoprolol, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Patients with second or third degree atrioventricular block cannot use bisoprolol. If patients have overt cardiac failure or cardiogenic shock, they can also not use this medication. And lastly, it would be contraindicated in patients who have severe sinus bradycardia or a slow heart rate. Now in terms of precautions, it should be noted that abrupt discontinuation of bisoprolol may exacerbate chest pain or induce a myocardial infarction or heart attack, so a gradual dose reduction is recommended when coming off this medication. It's not recommended to use this medication if a patient has bronchospastic disease, as it may prevent bronchodilation. For patients using this medication with congestive heart failure, they should be made aware that the inhibition of sympathetic stimulation could cause new onset or worsening of the condition. For patients with diabetes, they should be made aware that this medication may mask signs of hypoglycemia or low blood sugar, such as tachycardia or a rapid heart rate. Patients with hepatic or liver impairment may have to start using this medication on a lower dose and be a little bit more cautious when titrating the dose upward. And patients may also have to be cautious if they have renal impairment, so a creatinine clearance less than 40 mL per min. Beta blockers have the ability to mask signs of hyperthyroidism as well, so again, tachycardia or a rapid heart rate may be masked. Now once somebody has cleared the contraindications and is made aware of the precautions and warnings, and they start to use bisoprolol, they can expect to receive their dose orally. This medication is being used to treat hypertension or high blood pressure. Patients will often start off with a dose of 5 milligrams taken once daily. Some patients, however, will start off on 2.5 milligrams as well. In congestive heart failure, they may start off with 1.25 milligrams taken once daily, and the maximum dose in this situation would be 10 milligrams daily. If somebody was using this medication for the off-label indication of angina pectoris or chest pain, they may use 5 to 20 milligrams taken once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using bisoprolol, so I'll go over some of those here now. 9 to 11% of patients may experience a headache, and 2.5 to 3.5% of patients may experience diarrhea. Rhinitis may occur 3 to 4% of the time, and about 5% of patients may experience an upper respiratory infection. 6 to 8% of patients may also experience fatigue. That's all we're going to talk about today with bisoprolol. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.